actually created a script that, so hopefully anything Anne has said already, I will reiterate, and then we're going to demonstrate how to fall well, and then also how to try to get up from a fall, okay? So, here we go. The chance that each of us is going to experience a slip, trip, or fall at some point in our life is pretty high. I know I've already fallen many times in my life, but the chances of suffering a serious injury from that fall increase exponentially when you're inactive or in poor physical health. So, one thing to make sure you recognize is that age is not, it does not have to increase your risk for falling. It's more that as you get older, you tend to become less active, and it becomes harder to move, so that feeds into the inactivity. But if you can fight that drive to kind of slow down and get out there and maintain your physical activity, then you can actually decrease your risk for falls, and age does not have to be an increasing risk for falls. Many falls are preventable. So with small changes in your lifestyle and your living environment, they go a long way to helping reduce your risk for falls. Completing a falls risk screen, which we have down there, the Center for Disease Control has started a program that they're trying to put out to all the primary care physicians called STEADY, stopping elderly accidents, deaths, and injuries. That's what STEADY stands for. And it's just a questions you can ask yourself, and you can bring that form that we have down there to your doctor at your doctor's visit to see, are you at an increased risk for falls, and what is putting you at that increased risk for falls? Is it medication? Is it footwear? Is it your vision? What is putting you at an increased risk for falls? And there are things that you can do about it, so then you're not hopefully at that increased risk for falls. So we're talking vision and footwear checks, medication reviews, talking to your pharmacist. Maybe there's some medication that you're taking that you don't need to be taking, or maybe you're taking multiple medications for the same thing, and the redundancy is actually putting you at an increased risk for falls. So having a medication review can also be very helpful. Targeted exercise to maintain your physical health can go a really long way to reducing your risk for falls. Today, we hope to provide you with information to help you on your journey to becoming advocates for your own well-being and for maintaining an injury-free lifestyle. Falling well, that's why we're here today. Falling well involves an understanding of what puts you at an increased risk for a serious injury. Certain conditions, like osteoporosis, or medications like blood thinners, can put you at an increased risk for serious injury. We're not going to control if you have osteoporosis. We're not going to control that you're on blood thinners, but knowing that you are can help you come up with, hopefully, a plan and knowing how to approach situations to reduce the chance of serious injury from a fall. So having a plan or a mental schema is what I like to call it, and other people call it, can go a long way in helping you to reduce your risk for falls or a more serious injury from a fall. Athletes preparing for a big race or event will rehearse mentally how they're going to go through that event so that they can kind of foresee anything unexpected, and by rehearsing, they can help to maximize their performance. I think, and other people have proposed, that the same thing is true for falls, that you can develop some mental imagery. Anne and I are going to fall, and hopefully watching us fall correctly will tell you some of the things that will increase your risk for injury, but we're not going to demonstrate them, because what we want you to see today is correct falling. And then rehearsing in your head how to fall correctly 3 to 4 times a week, maybe 10 minutes. So this is mental exercise as opposed to physical exercise. Mentally practicing how to fall well can reduce your chance of having a serious injury should you fall. we're going to look at each of the different directions that you fall and describe how you can modify the fall or improve the fall to decrease your chances of a serious injury. I like the chuckle. So, excellent. Please do not physically